Hello, once again, good morning. My name is Dr. Yakub of Well-Life Hospital, Abuja. We're here once again to talk about something related to your health as usual. And today we shall be discussing something we have discussed in our previous videos related to proper diagnosis of typhoid fever. And hopefully at the end of the talk, we're going to talk about why this is important. In our previous video, we discussed the diagnosis of typhoid fever, how unfortunately it is made indiscriminately from what we see in clinical practice. I will just give a brief background concerning the disease again and then emphasize on the diagnosis properly. Typhoid fever, as we know, is a disease that is caused by a bacteria called Salmonella typhi. Now, this bacteria is contracted when we ingest foods or drinks that are contaminated by the bacteria. Usually, the contamination comes from the food handlers because man, as it were, is a carrier of that bacteria. So, when people who have some degree of personal poor hygiene handles foods, they can contaminate foods and drinks, and therefore people who eat such foods or drink such things can get the disease called typhoid fever. Now, for the purposes of the general population, we are not going to be very technical in this, but when we say typhoid fever, what it appears the general population understand by it is different from what in medical parlance we understand. But the understanding should be the same, because if we don't understand what it is, in most cases we make the wrong diagnosis, as is often happens. So for people in the medical parlance, we know that there are specifics that we need to have to make a diagnosis of typhoid fever. But for the general population, I want to say that these things include 3 different steps, and unless those steps are followed, if you probably make the diagnosis of typhoid fever, you may be doing it wrongly. And the first thing is for the doctor or healthcare provider to interact with you as a patient. That is what we call history, to find out if you have complaints, whether or not complaints related to your health, whether or not these complaints are due to anything close to typhoid fever first. That's the first thing the healthcare provider should do. So we call it history taking. So from that interaction, your doctors should be able to have reasons to now say, okay, I suspect typhoid fever in this case, and therefore the doctor will now attempt to examine you to find out whether or not what you told him related to typhoid fever, you have anything in your body that may suggest that. Yes, most of the symptoms of typhoid fever are actually not specific, because you have headaches can come from anything, you have fever can come from anything, that is body temperature, stomach pain, sometimes constipation, sometimes diarrhea. So many other disease entities can give this, including the malaria that we commonly see. So when the doctor looks out for symptoms, there are some very clear-cut things that may suggest typhoid fever, but we leave that for the doctors. So following that examination, we call it physical examination, the doctor now goes ahead to request for laboratory investigations. These laboratory investigations, there are those ones that would specifically diagnose typhoid fever, if there is, and there are those ones that are just what we call ancillary, meaning they're just supportive. Most of the time, what we see is that people don't even follow the very first step, that is history taking. Of course, where they don't even contact the healthcare provider, doctor, they won't go, they're not going to have themselves examined. So in most cases, what people do is that they just do the last step, carry out the last step, which is the laboratory investigation. And even the laboratory investigations to make diagnosis of typhoid fever, they are also very specific things. Specifically for the diagnosis, we need certain body samples to be cultured to identify the bacteria. And until that is done, we do not say emphatically that this patient has typhoid fever. And what body sample is taken, again, depends on the time the patient is presenting in the hospital. Generally, we say at some point you can only diagnose it when you do blood culture, that is, your blood is taken and a culture is made, or sometimes it is from stool culture, or sometimes from urine culture, depending on how soon or how late you are presenting in the hospital with your symptoms. Now, even when these symptoms or when the laboratory investigations show this, the doctor has to marry all of this together from your history, from physical examination findings, and the cultural result before the diagnosis of typhoid is made. Now, instead of this normality, what we see often is people making diagnoses either by themselves or from some side lab, or even doctors and nurses actually wrongly make this diagnosis of typhoid fever without necessarily even seeing the patient sometimes from a test called Widal test, or Widal titer, or Widal reaction. That's the commonest thing we see around. And that test, as we said in our previous video, is an outdated laboratory investigation that is not in any way specific for typhoid fever. There are some disease conditions, including malaria, that we commonly see that can cross-react to the extent that someone may have malaria and the without titer will be high. And that's the reason in our environment, in malaria and other malaria endemic zones, you constantly have this titer of without test reactions very high. As long as you are constantly exposed to malaria, of course the withdrawal reaction will be high because of cross reaction. So it is not anything specific for typhoid fever that we must be using, that we should be using every day for the diagnosis. So it is this inappropriate use of the withdrawal reaction that has led to ubiquitous diagnosis of typhoid fever all over the place, and it is wrong. Now, why is it wrong? Why do we have to be cautious when making the diagnosis of typhoid fever in this case? Now, of course, in most cases, because we know that it is bacteria that causes this, most of the times, once the diagnosis is made, you are treated with antibiotics. Now, we forget that when we use antibiotics inappropriately, we are exposing ourselves also to not just the side effect of the antibiotics, we're also exposing ourselves to some other medical conditions that we may not even be aware that are related to the side effect or to the inappropriate use of this antibiotic. Now, I'm going to mention just a few to buttress what we want to know. Now, generally, people are not aware, and unfortunately, even among healthcare professionals, we forget the fact that our body systems, in different parts of our body cavities, we have bacteria that are normally supposed to be in symbiotic relationship with us. They help us to survive. They help us in digestive processes. They're in our airways. They're in the nostrils, the gut, everywhere. And of course, even the reproductive tract. And what's the function of these organisms? They're there to participate in various body regulatory mechanisms. Like I said before, those ones in your intestines help in your digestion. Those ones in the reproductive tract help in maintaining a balance to avoid dangerous organisms from coming into you to cause disease. Those ones in the respiratory tract, all over the body, we have millions and millions of bacteria that are normally there also protecting us, like more or less like helping our immune system to also protect us from invaders, that is from the bad organisms. Now, when you take antibiotics, we forget the fact that we're also exposing these good bacteria to these antibiotics. And in most cases, you clear them as well. And they are not your problem. So once you clear them, you are now exposing yourself to invasion by more dangerous organisms. And this invasion in different body cavities has been scientifically proven to be associated with some disease conditions. And some of them we commonly see. Now, the ones we commonly see, especially among women, there is this condition we call bacterial vaginosis. Bacterial vaginosis is something that women experience where they have discharge that is mostly very, very offensive and embarrassing. I mean discharge from the genital tract. Now, this discharge in most cases comes because the friendly bacteria in the genital tract of the woman has been eliminated for some reasons, either from personal habits of douching or cleaning with antiseptic creams, or antiseptic solutions, or the indiscriminate use of antibiotics for the treatment of typhoid as it were. And so women experience these things recurrently, not knowing that it's because they're getting themselves exposed to antibiotics indiscriminately. So that is one thing that we should be aware of. The other thing in recent times now we're seeing is that in fact, even reproductive function, the disbalance or imbalance in the genital tract from the outside, the vagina through to the womb and all the way to the tubes, there are bacteria that have been found to be there that are supposed to protect you and maintain a balance such that even pregnancy is possible and miscarriages may not occur because of the presence of these nice bacteria, as it were. But when you now take antibiotics indiscriminately, what do? You expose them to the antibiotics, you clean them or clear them up, allow foreign bacteria to go in, and then you start struggling to get pregnant. Or when you're getting pregnant, you find it difficult to keep the pregnancy, and then you have recurrent miscarriages. So it's all over the place now. Gut, that is your intestine, the gut health, that is the bacteria in, or clearing the bacteria or clearance of the bacteria in your gut, is now being associated in a remote sense to even some things like what we call cardiovascular diseases, that is strokes, heart attacks, and the rest of them. So it is very necessary that we emphasize this for people to know. Do not expose yourself to antibiotics indiscriminately. And in our experience, typhoid fever or the wrong diagnosis of typhoid fever is one of the commonest reasons why everybody takes antibiotics all over the place. Now, the other dangerous thing to the community, as it were, apart from individuals, that comes from indiscriminate use of antibiotics is the problem of antibiotic resistance, which we're dealing with in our practice. People take antibiotics wrongly, and in most cases the doses are not appropriate in terms of the amount of antibiotics he or she is taking, the duration of treatment, because you don't even know what you're treating in the first place. And so where appropriate diagnosis is not made, you are not likely to take appropriate dose of antibiotics. And in most cases, even where you have organisms from other things, not necessarily the typhoid fever we're treating, they become resistant. And once they become resistant and they leave your body or cause you infection, they never go. And so we have this problem all over the place related to antibiotic resistance as a result of this indiscriminate use of antibiotics. So please, we want to appeal to all of us. Let's be our brother's keepers in the sense that we need to collectively preserve our health. It is not that we must sterilize ourselves to be alive. We need bacteria in our bodies to maintain proper body functions. So don't be so aggressive to use antibiotics. Don't be quick to use antibiotics. And that is why in some places, developed world, antibiotics are only prescribed by doctors. You can't walk up to any pharmacy or any store by yourself and take antibiotics anyhow. In most cases, it is prescribed. That is because they want to regulate their use because of these things we have mentioned earlier. So please, let's be aware. Anytime you suspect you have typhoid fever, please visit the appropriate health facility. Ensure that you interact with your healthcare provider, doctors. Ensure that the appropriate examination and laboratory investigations are done, and then appropriate diagnosis is made. Otherwise, you may be exposing yourself to unnecessary use of antibiotics and the things we have mentioned. So we hope that this subject matter, following this discussion, people should seek more information. Of course, online these days there's so much sources of information. I hope that everybody would take care of his health or himself or herself in this manner. Thank you very much.